For more than 47 years, our nonprofit, Resources for Seniors, has supported older adults and caregivers in Wake County. We can help in many different ways, including adult daycare programs, ramps and repairs, in-home supports, and consultation and referrals. Indeed, we're who to call when you're not sure who to call. Resources for Seniors stands ready to support you in your caregiving journey.
I'm Mark Costley, the founding attorney of Clarity Legal Group, the Triangle Area estate planning and elder law firm. You know those people who become overwhelmed dealing with the multiple challenges of being a caregiver? Clarity Legal Group helps people establish legal tools that avoid confusion, give them peace of mind, give them asset protection, and in some cases help them qualify for Medicaid. We help people get it right in the face of some of life's most important challenges. We don't just provide wills, trusts, and powers of attorney. We provide solutions and ongoing support. We provide clarity and peace of mind. It would be a privilege to help you.
Are you like 80% of seniors who would like to age in your current home? Call Wisdom Senior Care. Are you currently taking care of a loved one and finding yourself frustrated, tired, and even lonely? Call Wisdom Senior Care. Always available, dependable, and flexible. Come partner with Wisdom Senior Care, keeping wisdom at home.
Welcome, people from the Triangle and beyond. I'm Cherie Hylton, community educator for the Alzheimer's Association. And today we're going to talk about Dementia Conversations, having that difficult conversation with people, with your entire family, around the person that's experiencing some cognitive changes in their life. I'm picturing you. I know we're virtual today, so usually I would look at the audience and I would ask you to raise your hand. But I'd like to know how many of you are currently caregivers or care partners. How many of you are long-distance care partners? I see that hand. You can put it down. I'd like to know if you're a working caregiver. Are you somebody that just loves coming to conferences like me? And you love learning about resources that even if you're not in it right now, you're going to be ready when someone in your neighborhood or in your circle of influence needs to have these hard conversations. And those conversations circle around getting to the doctor, deciding when it's necessary to stop driving, and making legal and financial plans. What do you notice about these three issues? The generation in front of us, you didn't talk about those sort of things at the supper table. You didn't ask women how old they were, and you didn't know how much your parents made. Of course, now, I was just talking to someone this morning, and we've gone from the stress of COVID, and she was saying, Calgon, take me away. And then we've moved to the 2 bathtubs and people holding hands. So maybe people are talking about things more. But still, it does come back to these central issues and having that conversation so that you can make progress and be ready. So today's program, we're going to help you. We're going to provide you with tips on how to break the ice and get going. We're going to help you plan ahead and build a team. It's all about building a team. You'll hear that throughout. That's threaded throughout. We're going to give you the opportunity to hear from real people who have been on this journey, and they have some great tips to share and some wonderful insight. And lastly, they're all my favorite, but connecting you to helpful resources. That's why you're at this conference. Maybe you don't see yourself as a caregiver. Maybe you're just seeing some changes. I was thinking about her friend that was a real estate agent, and she drove people everywhere. This was before GPS. There was a time before GPS, and she could get people to the house they were looking at and back. She was giving us a ride to the airport one day and weaving in and out of the traffic and not signaling. Looking back, that was one of the beginnings of this journey. She just died at 92 in a wonderful situation with a lot of people around her that cared, even if it was virtually. But you start to notice changes, but there's barriers. You've got on the one side the person saying, nothing's wrong with me, what's your problem? Don't worry about me, I'm fine, I don't want to be a burden to the kids. And then on the other side, the person kind of looking in is thinking, well, maybe my sister's taking care of it. She lives closer. Or maybe I'm not seeing what I'm seeing. I could be totally wrong. So what to do? What to do? To have that successful conversation, you need to start sooner rather than later. And if you haven't started sooner, remember this information is going to help you as well as maybe help somebody that you know. But why sooner rather than later? It just makes sense because we want to support the autonomy of the person and give them the best chance to make their decisions ahead of time. What do they want? Where do they want to age in place? How can we help? And to get early intervention. So you want to start sooner and you want to get their input. You want person-directed information. And then we're going to finesse. You just can't hit them with honesty. Some families are like that. But if you could build a bridge of building trust along the way, that can go a long way when the conversation gets harder, a little bit more tense. So you want to finesse and you want to practice, build that bridge. Take notes. Did I say take notes? Even if it's on your calendar. Mom was up 3 times this week thinking it was time to get the hay in. She had a reaction to this medication. You think you're going to remember? But how many of you, even this morning, couldn't find your car keys? We think we're going to remember, or we know, when we change the printer ink, but you don't. Life gets busy. There's a lot of input. Start taking notes, and that's going to come in handy when you have to talk with the medical team. So you have concrete information to share with them. You're going to practice the conversation. Have a buddy, somebody where you can, how does this sound? You be mom, and I'm using mom, but it could be your daughter, you caregivers. Some of you are taking care of your children. Some of you are sandwiched between children at home and taking care of a loved one. It could be a neighbor. So when I say mom, it's my generic for the person with the symptoms of dementia that you're alongside. That's my general. So you're going to practice with that person. And then make sure that the time and the place is comfortable, that you don't just hit them cold, but it's comfortable for you, it's comfortable for them. There's enough margin, not at the end of a big shopping trip or at the end of a sad movie or something where the person dies. You pick the time and you're really intentional about that. None of this will work every time. I've been kicked to the curb many times with my great ideas, but maybe tomorrow that same idea will work. So don't give up. Just keep adding to tools in your toolbox. The very fact that you're at this conference tells me that you really care about adding some tools to your toolbox. So, the famous doctor visit. There's signs of normal aging. Any of you have tried to get on Zoom and dealt with technology, you do wonder if you're getting a form of dementia, but that's sometimes normal aging, dealing with the stresses of life. But when you're talking about dementia, and there's many types, there are things that affect your daily life with a person. So if you were somebody that never could balance your checkbook, like my mother, she used to say, how could we be out of money? I still have more checks. Okay, but if you're a person that religiously balanced your checkbook and now you can't add 2 and 2, that is a significant change. So getting to that doctor is going to be really important. There could be anger. There's the stigma of dementia. I long to see the day when it's no more a stigma than if you hurt your knee or had any other chronic condition. But there is a stigma, and oftentimes family members are covering for the person in the early stages just because it is, we put so much value on our cognitive sharpness. So there's barriers to getting to the doctor. So we're going to look at some ways to overcome that. And here's Donna. She's going to share how she helped and was helped along the way.
I think you have to be honest. I think that's the important thing with it. To get a loved one to the doctor, I think you just need to be candid and honest of what are you trying to do. We're trying to understand what we're up against. It's just so important to do that, because you can't battle something that you don't know what you're battling. Again, it may not have been Alzheimer's, it could have been depression, it could have been so many other things. And guess what? There's other things you can do to take care of those issues as well. But that's what you need to be able to do. You can't ignore something, it's not going to go away.
So tips for getting to the doctor. Remember that words do matter. Use words that the person is used to, not, we're going to have you assessed for Alzheimer's. You want to use the words that they're using. Typically, the person with cognitive loss starts noticing things themselves. That recipe they made all the time, they forgot one ingredient, and then they can't remember where they put the recipe, and it's starting to really bother them. Or they're just feeling a little unsure. It blows a hole in your confidence. So that you could start with that. You're noticing some of those changes. Time to go to the doctor. It could be your blood pressure acting up. It's not always dementia. You want to get them to the doctor because there's certain things that look like dementia, and they're not. There could be a low thyroid. It could be problems with their blood pressure. It could be depression. There's a host of things. And once you can make a differential diagnosis, you can get early intervention if it is dementia. So you want to use the right words. Words really matter, and your tone really matters. This is where you want to pick the right person in the family that has that influence. You can have two people in the same family, and you can say the exact same words to me, and you could say, but I'll take it from you and not from you. All family dynamics are fascinating, aren't they? I see some heads nodding out there. Pick a time and place that's really comfortable. And I want to talk about the annual visit. This is a really important benefit with Medicare, and a lot of people don't know about it. When you turn 65, once a year you get a wellness check, and this is going to help get that baseline of people's cognition. So you can say, it's time for your annual wellness. This is your tax dollars hard at work, and we can get you there. We can get you to have a screen, and let's just find out if there's something that we can do for you, Mom. Make it a pleasant outing. Stop at her favorite restaurant once we can get some people into the venues, or eat outside. But make it something that they want to do. Don't overtire them. People that are starting to get memory loss, they'll rally for the doctor's appointment and they'll be tired. So, make it something fun. You want to get the family input. What are people seeing? Now, this can get a little tricky because sometimes there's a seagull relative that flies in from California, drops her load, and then leaves. But not that there's anything wrong with long-distance caregiving. Sometimes the person here that's doing the bulk doesn't want to give up control either. So everybody owns a piece of this. But get the family input. And then lastly, there's something in care we call a therapeutic fib. Now, you don't go right there. Remember, we're respecting the individual. We're at every turn assigning the dignity that I want when these conversations will come up. But there's times when there's just so much resistance. I'm thinking of a gentleman that really needed to be in a day program. The family had to work, and he just had a busy kind of dementia, and he needed to go, but he pinched his pennies, and he wasn't going to pay for any old social club kind of thing. Well, find out he was a veteran. So the angle the social worker used was, you're a veteran, right? Well, it's free for veterans, and thank you for your service. And that got him over the hump into the program, and then he would never miss a day because he had to go to his club, and he had to talk about Sandy Koufax. And it became a part of his day. But we had to help him get over the hump of, I can't spend any more money. I went through depression. What if I need it? So making sure that the therapeutic fib is a last resort, but it is a tool in the toolbox. So that's the doctor's visit. Now, when to stop driving? This is such a tough one. You know, you start to see some fender benders, a few tickets, the way you follow this person driving and they're not doing well. So Chris is going to talk here about how he handled it with his dad. And there's a lot of good insight here, emotionally and practically.
There's no exact answer on this is when you stop driving. You could tell when coming up to an intersection, as an example, the ability to understand what's going on around you was starting to deteriorate a little bit. Being on the highway with cars on both sides becomes a little bit more difficult. And first and foremost, the safety of everybody in the car as well as other drivers on the road. You think about that and you want to make sure you're not putting anybody in danger. But then the difficult part is telling your dad, who you love, and you know he loves driving, and he's used to it, that he can no longer do that. But then even then, taking the keys away full time was very difficult. The doctor was very helpful in just saying, medically, you can't do this anymore. But my mother had the hardest time with this because she knew how much this was going to hurt him as well. And this is one of the first things that we had to deal with as a family when it came to telling my dad that he had to stop doing something because of this disease. That meant a lot to him.
When to stop driving. You want to plan ahead. When you go to the Alzheimer's website, there's a wonderful whole section on safe driving. And there's actually a contract in there that the person who's just starting to have memory loss can say, this is my handwriting on September 2nd, and I give my permission that if my family or Tom notices that I'm not driving well, I will give up my keys. But there's also good ways where people can get their driving tested. Sometimes OT will do this. Sometimes AARP has some good links. But if you scroll down on the Alzheimer's website, there's some great tools for helping you with the driving question. This is a big one. You can express your concern. I noticed, use iMessages. I noticed this is happening. I was following you, and then you go right into, I'm really concerned. I know you wouldn't want to hurt yourself or anybody else. Sheila's going to talk about how her family went through it, but also the practical things that they put in place to help her dad.
Some tips on having the conversation is pointing out, especially for my father, the potential danger to others that it may cause if he's behind the wheel. And just talking about it from the standpoint that this is not only the best thing for you, but this is also the best thing for others around you. And these are some of the alternatives, making sure that this is what's going to happen, having a plan. If mom can't take you, then Uncle Thomas or will be here to take you, and we will make sure that you're getting out of the house and that you're doing some things. So, presenting the bad news, but then also presenting the plan. And for my father, that's really, really important to have a plan.
Remember to offer alternatives. Come to the table. Remember the Seagull sister? Well, maybe she can pay for Uber. Or the neighbors or somebody wants to do something. Maybe they could pay for transport to get the person, not just to doctor's appointments, but to the fun things that they want to do that gives them a quality of life. And if you look around with our vendors today and the people that support the Caregiver Summit, sometimes you'll find real people that will take you. It's a service of some of the care providers. They'll pick you up, they'll take you, they'll wait with you at the doctor's, they'll bring mom back and see her to the door. You can't replace that. That's a wonderful added value. Sometimes you need that esteemed professional to, like the doctor, will write a script and you have to tape it on the fridge. It says, no more driving for medical reasons. And the generation ahead of us, they listen to the doctor, a lot of them. So you can bring the doctor in on the medical team in on it, or maybe it's a family lawyer. Whoever has their ear, you want to bring them into the conversation sooner rather than later. Here's Wendy talking about the emotional side of how hard it is. Picture yourself right now, tomorrow, if you were not able to drive? What would you do? Now, some of us have experienced a voluntary situation with the virus, but what if that was the way it was? So we need to be sensitive. We need to be empathetic, and she has some good insight on that.
Talking to somebody about stopping driving, I think it's most important to understand that that is tied to someone's independence more than most things. And so by saying you can't do this anymore is like telling the person, it's like ripping away their independence. And that doesn't feel good for anybody. I know that I've always tried to put myself in that situation. What would I think if someone was saying this to me? You don't get to do this anymore. And how would I feel? And how would I want somebody to talk to me about this? And so if you try to I think sometimes too many people try to approach it as, very punitive. And I'm doing what's right for you. So why don't you understand, without really turning the tables and putting themselves in that position, understanding, how helpless that feels to take those things away. It's important to be thoughtful about what that experience is like for the individual.
So we're moving from driving, and we're going to talk about legal and financial situations. We've covered the doctor, we've covered the driving. One of the ways we go about our lives independently is with our finances and our future plans and what we're going to do and how we're going to use our discretionary income. What's that? No. So this needs to be addressed because care for dementia is costly, and it only gets more expensive down the road. That's just reality. So Chris, again, is going to talk about how he handled it with his dad.
Financially, this disease will increase the cost of living. It's just a fact. So planning for those extra costs is that much more important than what you were planning for before. And so you have to review everything that's in place, see what changes need to be made, both legally and financially, and you have to monitor that going forward afterwards too.
These conversations can make people feel reluctant and uncomfortable, intrusive. We've already covered that. I usually play Julie's part here twice, but just listen twice as hard. She is there to go the distance.
Here's what I've come to after all of this. That it's the most loving and kind thing you can do for them is to be honest with them and say, this is like a really scary thing. And I feel a lot of discomfort bringing this up to you. But I tell them, if you're going to be the one who's going to take them on this journey, then you have to tell them, I'm going to be here on this journey with you. And there are things that we have to do to get this in place. We're going to go on this journey together. I've told you I'm going to be here with you till the end. So let's get this ready. It's like we're going to go on an ocean ship. We've got to get things packed up. We've got to figure out what we're taking with us. We got to get ready. And the things that we have to get ready, we have to make sure that we know which doctors you're going to be using. I need to get this signed, okay? So that if you go in there and they have to do surgery, for example, I got to have this durable power of attorney for health care for you. I have to have this worked out, okay? Now, if for some reason, okay, you need to go to rehab after something, I have to have these documents here, the financial stuff, so I can get these things taken care of for you while this is going on. I don't want to have anything get in the way of us being able to progress and keep doing this. I said, it seems hard because it's hard in our heads. Everybody's read about people who've stolen from elderly people, who've done these horrible things. But if you're the person who's approaching this with loving kindness and compassion, and you're willing to take this person on this journey, you're not doing a bad thing. You're doing the right thing by talking to them about it. And you approach it from the standpoint of, I'm here for you. I'm doing this for you. We're going to do this together. And I'm going to help you through this. And these are the tools that I need to make sure that we can do this.
Thank you, Julie. I would only add one more thing to what Julie said. and it's just one more sentence that you're saying to Auntie or your neighbor, whoever you have the privilege of coming alongside. You would do it for me. It just happens to be your turn. But I know that you would do it for me. And I'm going to do this with you, and we're going to see it through to the end. I am with you. I'm not going anywhere. So because of that, we need to gather our stuff. We have to gather the data, get the information. One of the best things you can do, if you don't have a copier, is do a screenshot, click, click, as you're looking at the bank accounts and the different contacts. Start slowly, break this down into bits so that you can start getting a folder together. Where's the bank account? Where are the insurance policies and the will? Is it in the right state? Advance directives. There's a lot of help in the summit today about what you need and where to get it. But start slow, don't overwhelm them, and include them to the extent possible. You want to involve other people in their observations. Remember getting the information that they're seeing. Maybe this is where, when you're building your team, they can say, well, I'll pay for a housekeeper to come in while you're working on the banking, or I'll take over the power of attorney if mom wants that. But this is where you can divvy up things with the family. Building your team is so important. The care team. Of course, it starts, if you look, the person themselves has to be at the center of that care team and the family. However they describe their family. Their family could be their beloved community. There's a lot of people I see out in the community that are there alone, and they've either outlived their family or there's some fracture there. But whatever they define as family, then that's who you want to help. But that's just a start. You have to have the medical team. Now, I should have mentioned back before when we were talking about getting the information to the doctor. Early on, you need a point guard, to use a sports analogy. We're building a deep bench, sports analogy, or not. You need to get the information permission to have the information from the doctor with all the HIPAA rules. Early on, when the person has capacity and can make that decision, please encourage them. One of the first things to have your name, to have the records or the information that they need. So zoom ahead. You've got the medical team fully informed. Get a good neurologist and a primary all working together for the person you're helping. And the peers, what are they seeing? What's the peer group doing that could help? What are they noticing? Learn to ask for help. That's a very hard thing. It's sort of in our culture, we just value our independence. But when you're interdependent, you can actually get farther ahead and go the distance. In the workplace, you might be a working caregiver. There's employee assistance programs, and you could get family medical leave. You could get some support for the stress, but sometimes flexible schedules. Boy, we're learning about that, aren't we, now with COVID? But you can get some help at the workplace. The workplace can be part of your team. And then the community resources. The triangle is full of resources, and I think almost every week or two there's something from one of these conferences that I use to share with people, sometimes so practical, but also you need help downsizing, call this person. You need a hospital bed, here's where you go. So getting your resources, and a lot of the sponsors today can hook you up for that. Lastly, I want to talk about the Alzheimer's website. This is a treasure trove, and after the conference, you can just take some time and go. But I'll zoom over to support groups. You may have tried one and said, oh, that wasn't for me. Well, try again. Support groups are more than just touchy-feely You're not alone, which is huge. They can also be immensely practical. You can learn everything from how do I get somebody's pull-up on without having to take their jeans and socks and sneakers all the way off, but really practical things right to, well, how do I get a break? Where do I get respite? And who do I even ask? One of my favorite memories of the years in support group was we're putting the chairs away and sweeping up the popcorn or whatever, and I'd look out the window, and there, what I used to call the parking lot group, the second wave of really good connections was happening at people's cars, and we were heading out with our flip charts, and they were still talking. There's a lot to be said when we can all gather to promote support groups, and a lot of them are online right now. There's the navigator at the top of the slide there. You'll see that makes an individualized plan. It starts with your zip code. What do you need? What level of care? How do I know what's down the road? You can also go on that navigator, and you can have almost like a Google Doc where 2 o'clock mom has an appointment on Friday, and who can do it, and the person without 52 texts and calls, they can just plug in their information in real time. There's a resource finder. All's connected is like chat rooms where people, they kind of break it down by category. So maybe you're a person with cognitive loss or with Lewy body or early stage dementia, or you're caring for a child maybe with Down syndrome that has developed dementia. They break it down to just men, just women, and they can just get really deep and wide in the conversation with that. The helpline, 24/7, and I have called them at 2 a.m. just to see and said, so what are some of the questions people are asking you about? And they are master trained social clinicians, and they can point you in the right direction, and they handle everything from just, I don't know what to do, I'm going to drop mom off at the emergency room, I can't take this anymore, to, do you know what kind of lining I should use in the commode to make it more easy, and everything in between. So that 24/7 helpline is great, and I love that there's a real person on the other end. The Safety Center, they talk about how to help people that want to go walking and it's not safe, and they might go out into the road, and you've all heard the horror stories. They have really neat devices now, cameras in the home, GPS devices. There's a program with a sheriff's department that's free, and you can help people stay home as long as possible with some of these tools. There are other things that the Alzheimer's does. There's fundraisers. There's also Trial Match, where they need volunteers that are healthy and don't have Alzheimer's. I'm one of those so far. And they are doing research so that there will be a cure one of these days, and we will live to see it. As I'm looking out at you, and I just thank you for the time, I'm thinking of other people I've seen, people on the other end of that call on the Alzheimer's helpline, people that have felt so all alone, people that just didn't know, they just wanted to vent. They didn't necessarily want you to fix it, but they just had to tell someone, and it's easier to tell a stranger sometimes than your own family, because we all have that baggage. It's also wonderful to see such a diverse group of people out here today, and I just am very excited about the future of this summit and the future of caregiving. You know, you might be the first person in your family that's come to one of these conferences and are just blown away like I was with the resources. I remember last year this really cool vest that was invented by a local North Carolinian, and I just recommended that, a lift vest that has a bunch of loops on it. There's some really cool things out there that, as I'm looking at you, I'm just thinking, what are some of the things that you're wondering, and what are some of the experiences what do you need from this conference? And what I'm so glad is the robust amount of vendors and sponsors that you have now that you're registered, the whole year to go back and kind of dig deeper and more broadly about that. One of the things, maybe you're listening to this and you're going, I'm past the driving and, my loved one's getting sicker and sicker and has stopped eating. A lot of people don't realize that hospice is one of those sooner rather than later conversations. I listened to caregivers in group, panel discussions. And the last one I went to, I'd say 4 out of the 6 panel members said, I don't know what I would have done without XYZ Hospice because they supported me. And I'm glad to live long enough to see that people with dementia are getting care through hospice and palliative care, where they treat the symptoms, they help you stay out of pain, and they help you live to the very fullest till you leave. And this is a wonderful thing. It used to just have that association with cancer or, something like that, which is all important. There's so many good causes out there. But that person that's drifting and the eraser is slowly erasing their ability to do things and understand their environment, that eraser eventually, they forget how to eat, they forget how to turn themselves. And what a great need there are. And bravo to you out there. Then I'm looking at you. And I'm just so pleased, or I'm just so honored to know that you unpaid and paid caregivers are doing such a great job. As I spoke last year, I remember I asked everybody what was their favorite pie as the opener. I didn't do that this year, but I ended with my pie is humble pie. And you are going to know as a caregiver that just when you think you have all the answers, you have to pick up and start over again. You've just had today's dose of humble pie. But at the end, using some of these tools that we learned today and some of the ones you'll have in the conference, you just look back and you're on the other side and you go, I did the best I could at the time. And you'll be able to take that comfort and hope to other people as well. Based off my experience, I find that people are wondering what is the difference between dementia and Alzheimer's, and how do I find that out? You can certainly go to the website, but basically dementia is an umbrella term. Alzheimer's is the biggest type. Then there's Lewy body and different types. Getting that diagnosis early really helps. Becoming educated is a great tool in your toolbox. But here is something, just because you know the stages doesn't mean that your person is going to go through those stages. Every once in a while, the shade will come up and you'll see the core of that real person, but a lot of times the shade's down. So knowing what's ahead is really important. Caregivers often think they're the only one that can do it. I've been there. If you are away from the person you're caring for right now, you know exactly what they are. You know their body functions better than they do. You know how they're going to react. So of course you know the best way to do everything. And giving up that control so that you can go the distance, I know I've used that term a lot, but you get stressed, and then if you're not happy, they're not happy. They get that. They might be losing their words, but they know that emotional memory, whether they like you at the moment or not. So we need, as people that are helping you as a caregiver, to let you know that you need to get away, and it's okay. Give yourself permission. And when I say get away, I don't mean just get the car and go for mom's prescriptions and her groceries. That's not getting away. Or taking her to the doctor's appointment and stopping at Chick-fil-A. That's not getting away. Getting away is really getting away, and it can be very small and manageable. It can be a bath. It could be whatever you, reading a book uninterrupted, sitting on the porch and watching a thunderstorm. I've heard different people talk about what is that, but letting go. So this week I was talking to someone and said, our goal, they're helping us with the transfer, but is after you help, off you go. We really can pour the Raisin Bran You know, we've done that. And you go do something. We'll call you when it's time to transfer again. Giving yourself permission. And then also when you find something that works, making sure you communicate that to the team. Other people want to know how long. How long am I going to be doing this? And there's not an easy answer for that. That's where a lot of your pre-planning comes in. But always be building your bench, your subs. Just when you get a good situation, I don't mean to be depressing, but this is the truth. You just get the right, perfect person, and something comes up. They have to go to Maryland and be with their sister or something. So you're always backfilling with people that can help. You never can have too much of that support. So always let the neighbors know that mom's having some memory trouble, so they'll be on the lookout. People mostly want to help. They just don't know how sometimes. I'm one of those people that has a story for everything. And my husband and I were caregivers for over 26 years, on and off, for 5 different relatives. Everyone from, at one time there was an auntie living with us in her 90s, my mother-in-law with heart failure in her early 70s, and a toddler and 2 other children. And you look back and you go, how did we do that? And we did it one day at a time, and we did it not the greatest all the time, but I'm standing here, a little wobbly, but I'm standing here, and you can get on the other side. Took a lot of help and a lot of that humble pie that I'll talk about or have, where you just forgive yourself for what you didn't know. I'm passionate because caregivers make a difference, and that's what we want. We want somebody alongside us that gets us, that respects us, that knows what they're doing, they're caring, competent, and they don't forget that we're part of a community. I remember when one auntie came to live with us. Oh, I have stories. Aunt Gail, she was our favorite. She died on her 91st birthday. But she was pulling that cotton out of an aspirin bottle at her house down the road. And just the doing of that, she fell back and broke her, hit her head. She crawled to the phone and she said, Cherie, you always said I could come and live with you. Today's the day. And she lived with us till her 91st birthday. But what a privilege. I know it's work in those chat rooms. I remember a discussion where people said, this person's a victim, and the other person saying, no, it's a privilege. Well, probably both are true. And if the person feels like they're a victim, then they're a victim. But it was a privilege at that point, and we learned a lot as we did the caregiving. But there were times we were so stressed that just putting on a family meal was one more thing to do, or relating to my husband was one more thing on the checklist. So you had to pull back and practice some self-care. It is something you practice. You are not born taking care of ourselves. You learn the skill. You start with something small and manageable, and you're really glad. Maybe you think, well, I really want to get in touch with my high school friends. This week, maybe all you could do is find your address book, all right? But you're going in the right direction. So one of my little sayings is, it's not perfection, it's the direction you're going in, and you will get there. That's enough about me and my stories. Although I have a lot, if you have time, 1-800-CHERIE, and I'll fill you in. I have a story for everything. The grandkids point to a piece of furniture, and I tell them all about Helen Brown. But anyway, it's time for your questions, and we're so looking forward to that, for your questions. Thank you.